All right, this is going to be a demonstration of how to do a head-to-toe assessment. So this is our patient here, and we'll go ahead and start. So before I go into my patient room, I'm going to check the DOFNAP, the diagnosis, the doctor's orders, the frequency of the orders, the nurse's note, the allergies, and policies and procedures. I'm going to enter the room, so knock on the door. Can I come in?
Yes.
All right. Hi, I'm going to sanitize my hands as I walk in. My name is Katie. I'm going to be the nurse today. Would it be all right if I do a head-to-toe assessment on you?
Yeah, that's fine.
Okay, wonderful. And I would have provided privacy before I started my physical assessment, so I can pull the curtain. All right, can you first tell me your name and your birthday?
Wesley, but I like to go by Wes.
Okay, and what's your last name, Wesley?
Richards.
And your birthday?
2016.
You were born in 2016. What day and month?
January 11th.
Okay, great. That matches your ID band. Perfect. Any allergies that you're aware of?
No, I don't think so.
So based on that information, I already know for orientation that my patient is, he's alert, he's awake, and he's talking to me. And in terms of orientation status, he is oriented to self or person. So I'm going to further assess orientation. So can you tell me what month we're in?
April.
And what year is it?
2022.
All right. And can you tell me where you are right now?
The doctors.
Can you tell me why you're here today?
Just for a checkup.
Just for a checkup? Wonderful. That sounds great. So he's also oriented to person, place, time, and situation. So he is alert and oriented ×4. And at this point, you can do vital signs. Are you currently having any pain today?
No.
Okay, great. And at this point now, I'm going to go ahead and start with my head-to-toe assessment. So starting with his face, we're going to take a look here. And we're going to take a look at his eyes. And looking at his eyes, I visually see that he's not wearing any glasses. But I will ask my patient, do you wear any glasses?
No.
Do you wear any contacts?
No.
And do you have any difficulty with your vision?
No.
I'm going to go ahead and take a look. I don't see any obvious drainage coming out of his eyes. I'm looking at the sclera, which is the white parts, and they look white. Can you look here? Okay. They're not bloodshot. They're not jaundiced. Can you go ahead and pull your lower lids down for me, Wesley? Perfect. The conjunctiva is pink and moist. That looks fantastic. And then I'm just looking at the pupils to make sure that they look equal. And they do. And they also look round. And I'm going to grab my flashlight really quick, Wes. Would that be okay?
Okay.
All right, Wesley. So I'm going to check your pupils. I'm going to check and make sure that pupils respond to light or are reactive to light. So I'm going to take my flashlight. And I'm going to have Wesley, can you look straight ahead? Can you actually look at the camera for me straight ahead?
Yes.
Keep your eyes open, nice and wide. I'm going to shine a light in there. But continue looking right at the camera. And I see that his pupils constrict. Looking at the camera. Great. And I'm seeing that they do respond to the light. So pupils are equal, round, reactive to light. All right, Wesley. So now I'm going to check your ears if that's okay.
Okay.
Just looking at the ears, I'm always looking for symmetry. They look symmetrical, so did his eyes, so does his face in general. I'm going to take a look here. I don't see any drainage from his ears. Do you wear hearing aids at all?
No.
No. Any difficulty hearing?
No.
No, wonderful. Okay. So I'm going to just take a look at your nose. I don't see any drainage from nose, and it looks symmetrical. I'm going to take a look here at your mouth. Wonderful. Can you stick your tongue out for me? Okay, lift your tongue up. All right, I don't see any sores in there. I'm going to just take my flashlight and double check. Okay, put your tongue down for me. Great, so no open sores. It looks like you have all your natural teeth. Are those your teeth?
I actually lost one.
I see that, but you have a big boy tooth there now.
Huh?
Great.
And I have no loose
You
tooth.
have another loose tooth. Well, that is great. Do you brush your teeth?
Yes.
Fabulous. So he has all natural teeth. I don't see any cavities. And oral mucosa, no open sores. Skin, the mucosa is intact, pink, and moist. That's what we're looking for. Any difficulty eating, Wesley?
A little because of this.
Because of your loose tooth? Mm-hmm. Okay. Do you try to eat on the sides?
Yeah.
Wonderful.
I try to eat right here or right here.
Back there?
Or right here.
On that side. That's great. Okay.
And by the way, I got hope.
Oh, goodness. Okay, we'll mark that down when we get to your legs, okay? So what I'm going to do now is check and see how strong you are, okay? I'm going to have you put your hands like this for me, right on my hands. Good. And can you push towards me? So that is hand push. And then I'm going to have you put your hands like this. And I'm going to have you pull back. Okay. Can you go ahead and pull back? Oh, you're so strong. They are equal for push and pull. That's what we're looking for. Can you also grab my fingers? How? With your whole hand like this. Okay. Let's see here. Go ahead. Squeeze. Great. You're really strong. And those are equal. Perfect. I'm just going to feel your skin. Is that okay? Mm-hmm. All right. So I'm just going to feel skin as I go down through my assessment. He is warm and dry. That looks great. And temperatures are equal. All right, Wesley. Can I see your fingers? Okay, let's turn here. I'm going to check your capillary refill here. So I'm going to take each finger and check capillary refill. They should be equal and brisk, so less than 3 seconds. And those are all brisk. Wonderful. All right, I'm going to check your pulses here, if that's okay. Radial pulses are equal and they're strong. Looking at upper extremities, I don't see any swelling, no edema. And then I'm going to take a listen to, we're going to move down here to his chest and his abdomen. So I'm going to take a look here. His respirations are regular and unlabored. So I'm going to take a listen to his heart. Okay. And the best point to listen is the apex. So 5th intercostal, mid-clavicular line. Can you just sit for me? Okay, we're going to take a listen right here. And you always do this under clothing, so your stethoscope to the skin. And this is where you're going to count your apical pulse. You're going to count for 60 seconds. And you're going to tell us, is it regular or irregular? So do you hear the lub-dub, 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 lub-dub? And is it regular? Okay. So your heart is regular, and I would have gotten an apical pulse. Since you're sitting up, would it be okay if I take a listen to your breathing? Yeah. Okay. So we'll listen to lung sounds. I'm going to do 6 on the front, 2 on the sides, and I'm going to do 8 on the back. Okay. Can you take a deep breath? And out. Good job. And again. Be sure to give your patient time. Great. Can I have you raise your arms to the side? Great. And I'm going to have you take another deep breath. Deep breath. Come over to the same side. We want to go side by side. We're going to move down. Great job. One more time here. Good. And can I have you turn around so I can see your back, Wes? Okay, perfect. Great. Just like that, okay? All right, Wesley, a few more times here. You're going to start in because you have to keep in mind where your scapula is and we're not going to hear much over bone. So starting here and take a deep breath. Great job. So again, respirations are regular, they're unlabored, and all of his lung sounds throughout all fields are clear. All right, Wesley, can I have you lay down now? Okay, let's put your legs up here. I'm gonna have you turn just a little bit here. Wonderful. You can put your arms by your side if you'd like. Are you comfortable like that? Okay, great. And is it all right if I pull up your shirt a little bit?
Yes.
Okay. So I'm going to do my abdominal inspection, and at first I'm just looking. We always look first. And I'm looking for any distension, looking for anything that's asymmetrical. Right now his belly looks flat. I don't see any distension, and I don't see any obvious hernias, any scars. Gonna feel temperature. He's nice and warm and dry. All right, and I can ask him, Wesley, when was the last time you had a bowel movement?
What's that?
When was the last time you pooped?
Yesterday.
Yesterday. And what did your poop look like? What color was it?
Brown. Okay.
Was it formed?
Yes.
Yes, okay. And what size was it? Can you tell me?
Like this. No, like this.
Okay, so about a medium. Any pain in your belly?
No.
No? Okay. Would it be okay if I took a listen to your belly?
Yes.
Okay. So I'm going to auscultate next. And we're going to start in the right lower quadrant, move to the right upper, move to the left upper, and then the left lower. A little cold here, Wes. And I hear the gurgling, the bowel sounds in there. I hear them there. Relax. I hear them there as well. And here as well. So bowel sounds are present in all 4 quadrants. And then lastly, I'm going to palpate, and we're just gently palpating. So again, I'm going to work in the fashion that I was listening. Wesley, let me know if you have any pain when I'm touching, okay? And I'm feeling for any abnormal findings, again, like a hernia, or if he's complaining of any tenderness. Any pain, or are you just ticklish?
I just did.
You're just ticklish. No pain when I press?
No.
Okay, wonderful. And his abdomen was soft as well. Wesley, do you have any difficulty making it to the bathroom to poop? Do you always make it to the toilet?
Yes.
When you're talking about urinating or peeing, do you always make it to the toilet?
Yes.
Does it burn or hurt when you pee at all?
No.
And what would you say that your urine or your pee looks like? Is it yellow?
Yellow sometimes.
Is it light yellow, dark yellow?
White yellows.
Do you pee at least 3 times a day?
Yeah.
Okay, great. Okay, so I'm going to take a look here at your legs. So I'm going to just shimmy his pant legs up a little bit. And again, you're always assessing skin as you go. So I do see one obvious marking here. He has a scab, so he must have had an abrasion at some point. So we'll document that, and you could measure it as well to document in your note. So looking here, I'm just going to take a feel with temperature. Okay, great. So
Do you
skin
want to
is...
know how that happened?
Yeah, just a second. Skin is warm and dry, and aside from this marking, everything looks great. I don't see any... Is it okay if I take your socks off?
Sure.
Okay. I'm looking at his extremities, and I don't see any swelling, so no edema, no redness. Again, everything looks great. Do you have any pain in your calves?
No.
No calf tenderness. Again, no edema. So tell me now, Wes, how did you get this mark on your knee?
I fell off my bike.
Oh, no.
I was driving around the box, and then I fell.
Oh, no. How does it feel now?
Good.
Good. It looks like a scab. It looks like it's healing wonderfully.
Yeah, I got it in March.
Okay, so
March
a little...
20th.
Oh, okay. So about a week and a half ago?
Uh-huh.
Well, it looks like it's healing okay. Do you have any pain?
No.
No? You're able to bend your knee okay? Perfect. Okay. So, again, I would mark that, measure that, and mark it down in my notes. All right, Wes. Are you able to pick up your leg? Great. Can you bend your knee? Can you bend your ankle? Can you go like this with your ankle? Like this? Like that? Great job. Can you do it with your other leg? Great. Okay. And just seeing how he's laying, I know that he has active range of motion in all of his extremities. So I'm going to check your strength in your feet like I did in your arms, if that's okay. So I'm going to go ahead and have you push your feet down towards my hands. Great job. That is equal and strong. And then I'm going to have you pull back towards your face. Great job. Good. So push, pull, those are equal. While I'm down here at his feet, I'm going to go ahead and do pedal pulses. Those are strong and regular and symmetrical. Then I'm going to take a peek here. Always going to take a peek in between toes. No open skin, no wounds. Great. No issues on the heels. And then I'm going to do cap refill. So same toes at the same time. Oh, I'm sorry. And we're going to compare. All right, brisk for both sides. I'm going to put that on here. All right, I'll let you get that one on. So we can pull your pant legs down here, Wes. Great. Okay, this one I'm going to sanitize my hands because I was touching his feet. So now we're going to talk about his mobility. So I know that when he walked into the building, he was ambulating. But if I had not seen that, then I'm going to ask him, can you stand here for me, Wes? Great. And can you turn around? And I would put a gait belt on my patient if this is the first time that I'm walking them. And I would have my hand under the gait belt and walk behind them. Go ahead and take a couple steps, Wes. Great. Okay, come on back. So you would walk with your patient. And I would say that he's independent. Gait is steady. No issues there. You would always ask if they have any assistive devices like a cane, a wheelchair, walker, anything like that. As I was going through my head to toe assessment, I was assessing skin. At this point, I would have him stand up and I could ask him to turn around again and we can take a look at his backside. This would be something great to do if you take your patient to the bathroom. You would also want to assess their buttock, especially in the crack here, and then for any wounds anywhere specific. You never want to forget that. So go ahead and have a seat here, Wes. And I'm just going to ask you a couple more questions if that's okay. Okay?
Yeah.
Have you fallen in the last 90 days or 3 months, Wes?
No.
No.
I only fell at March 20th.
When you fell off your bike? Okay. Do you have any trouble eating? I know we did talk about that a little earlier, but no difficulty eating except for that tooth? Mm-hmm. Okay, great. Do you find that you eat all of your meals?
Yeah, sometimes.
Yeah. And what do you typically have for, let's say, breakfast?
So I eat breakfast at school a lot, but today I had cereal.
Okay. Did you eat it all?
Yes.
So for lunch and dinner, do you eat everything that your mom and dad give you?
Yeah.
Okay. Throughout my assessment, he doesn't seem anxious. He does not seem like he's having mood swings at all, but you could always confirm and ask your patient how they're feeling. Are you feeling anxious at all?
No.
Do you have any mood swings? Do you feel like 1 minute you're happy and 1 minute you're sad?
No.
Do you have any thoughts about hurting yourself or anyone else?
No.
No? Great. Anything that you're concerned about today?
No.
And then we're going to touch on the spices. Again, some of those we did touch on already, but it's just something to trigger in your mind to remember to ask these questions. Do you have any difficulty sleeping at night, Wesley?
No.
No. Okay. So the sleeping is, S is for sleeping. And then P is for problems eating. And we did already talk about that. And then we're going to talk about I, which is incontinence. And I did already ask him urinary and bowel continence. He is alert and oriented ×4, so I'm not concerned about confusion, which is the C in spices. And then E stands for evidence of falls. We did already discuss that he has not had any falls except for his one incident where he fell off of his bicycle. But that would be something you can ask your patient, and you can always look in the chart to find out information for that as well. And then the last letter is another S, and that is for skin breakdown. We did already assess as we went through the head to toe assessment for skin breakdown. And aside from the abrasion and the scab now that he has on his knee, he had no other skin issues. All right, Wesley, well, that is all of my head to toe assessment. I thank you very much for allowing me to do that. Is there anything I can get you before I go?
No.
Okay. Well, thank you so much, and you have a great day.
I will, you too.
Thank you.